PrEP for trans folk. Hello, my name is Helena. I'm a member of the Transgender Task Force of the Tennessee Department of Health. We are a multiracial group of trans women, trans men, and non-binary people living throughout the state. We work to ensure that trans people in Tennessee get equal access to HIV prevention and treatment. And trans voices are represented in discussions about HIV funding, strategies, and priorities. In this video, I'll be providing some education about PrEP geared towards the trans community. Because PrEP is an amazing HIV prevention tool, everyone deserves to know about it. I will outline the basic information someone needs to know about PrEP, like what it is, how well it works, how to take it, how safe it is, and how to access it in Tennessee. After that, I'll give some context about what it looks like to live with HIV. Then I'll talk through some of the reasons why someone might benefit from PrEP. At the end, I'll share some personal stories by different trans people about why they use PrEP. Finally, I'll share additional resources if you want to learn more about where the information in this video came from. Even if you don't think you need PrEP, it may be that trans people in your community could benefit from it and may not know about it. Please think about PrEP not just in relation to your own life, but in relation to the lives of other trans people you know. And consider sharing this information with them if you think PrEP could be helpful to them. Next slide, please. PrEP is a daily pill that prevents HIV. First, PrEP is a pill someone can take that will help them stay HIV negative, even if they're exposed to HIV through sex or sharing needles. Even though PrEP was first approved as an HIV prevention method in the US in 2012, many people still don't know about it. Trans people in particular may be less aware of PrEP than other people because we are often left out of the HIV prevention efforts and face so many barriers to healthcare access. Next slide, please. PrEP is extremely effective. When taken daily, PrEP reduces the risk of getting HIV through sex by 99%. That statistic can be a bit difficult to understand. How I typically like to explain it is that PrEP provides nearly complete protection against HIV when someone takes it every day. To show just how protective PrEP is, out of over 650,000 people using PrEP worldwide, there have only been 4 cases in history where someone got HIV when taking the PrEP pill daily. That means PrEP is significantly more protective than condoms at preventing HIV. For comparison, the CDC estimates that condoms only lower the risk of acquiring HIV through sex by 63 to 91%, depending on the type of sex someone has. And just so you know, when we talk about HIV being transmitted through sex, we're mainly talking about certain types of sex. Some people never have the type of sex that involves a significant likelihood of transmitting HIV, like people assigned female at birth who only ever have sex with other people assigned female at birth, or people assigned male at birth who only ever have oral sex. I'm going to use anatomical terms to just be as specific as possible and make sure everyone understands what I'm saying. Though I know as trans people, we often use other terms when talking about our bodies. Vaginal sex, meaning specifically sex that involves a penis inside a vagina, and anal sex, meaning specifically a penis inside a butt, are the only 2 types of sex that have a significant chance of transmission of HIV. Every other type of sex has extremely low to no risk of transmitting HIV, according to the CDC, that is. The CDC considers the risk of getting HIV from oral sex to be so low that they can't even measure it. PrEP also provides good protection against HIV transmission through sharing needles. It's estimated to reduce the risk of HIV transmission through sharing needles by at least 74 to 84%. Because of that, PrEP can be a really valuable option for anyone who injects drugs, hormones, or silicone and thinks there's some chance they may end up sharing needles with someone else, whether they're planning to share needles or not. And just to be clear, if someone uses new needles every time they inject, like by getting syringes from a syringe service program or exchange program, a pharmacy, or ordering them online. There's no chance they would get HIV through injection. How to take PrEP. PrEP is most effective when taken every day. There are a lot of strategies someone can use to help them remember to take a pill every day if that's something they struggle with. However, even if someone struggles to take PrEP every single day, it's still very protective to use PrEP because PrEP protective levels build up in someone's system over time. Think of it this way. If you take PrEP pill 9 days in a row and forget it on the 10th, studies show that you still have almost perfect protection on that one day you didn't take it. However, if you use condoms during sex 9 times and on the 10th day of having sex, don't use condoms. You have zero protection from HIV that time you didn't use a condom. A lot of trans people know how committed we can be to taking medication if we see it's connected to maintaining our well being. Because many of us take gender affirming hormones and are extremely passionate about making sure we always have them. Many trans people have a similar level of commitment to taking PrEP daily. Because we know how much it improves our lives and makes a difference in our experience of sex and relationship. PrEP is extremely safe to use, including for trans people. PrEP can help any HIV negative person stay HIV negative, no matter who they are. It's not just for cis gay men. PrEP is for trans people too. Regardless of the specifics of someone's identity, whether they're using hormones, whether they've had certain surgeries, it's for trans women, trans men, non-binary people, cis women, it's for everyone. There's a lot of fear among trans people that different medications could interfere with our hormone levels and that we might have to choose between our transition and other parts of our medical care. Even though people worry about that a lot with PrEP, there's no reason for concern. I want to be very clear. PrEP does not affect hormone levels. It is safe to take PrEP and gender affirming hormones together. PrEP is still very effective at preventing HIV for trans people who take gender affirming hormones. As a trans woman who is on PrEP and hormones, and speaking on behalf of other members of the Transgender Task Force who also use PrEP and hormones, I want all trans people to feel comfortable accessing PrEP. Like any medication, PrEP can have side effects, of course. However, most people experience no side effects. And for the few people who do, the side effects are usually very mild and only last a few weeks. PrEP providers will monitor any PrEP patient for side effects. PrEP is considered an extremely safe medication. Next slide, please. PrEP is accessible in Tennessee. Regardless of someone's insurance status, citizenship status, or income level, there are ways to get PrEP in Tennessee, almost always for free or very cheap. We know trans people are more likely to be unemployed and uninsured than other groups of people. That can be a big barrier to accessing a lot of types of medical care, but it doesn't need to be a barrier to accessing PrEP. There are many organizations throughout the state that have PrEP navigators who can handle all of the paperwork and details of getting on PrEP, like communicating with medication assistance programs, pharmacists or pharmacies, excuse me, and insurance plans. The website getprep10.com has a database of PrEP providers and PrEP navigators throughout the state. Many gender affirming hormone providers can also provide PrEP if you request it. Some PrEP providers can offer PrEP through telemedicine, by video or phone appointments. That can be a great option for someone with limited access to transportation or someone living in a rural area far from providers. Telemedicine PrEP can also be a great option for someone who's especially concerned with privacy and wouldn't want people to see them accessing sexual health care services, for whatever reason that might be. As trans people, we know that not every medical provider is affirming of our identities or competent at serving our needs. and we're often reluctant to seek medical services out of fear of being misgendered or otherwise mistreated by the people who are supposed to be caring for us. Unfortunately, because PrEP is associated with LGBTQ people and because HIV is so stigmatized, some medical providers still don't know about PrEP or aren't comfortable prescribing it. However, there are still many good PrEP providers out there, including in Tennessee. I work as a PrEP navigator here in Memphis, and there are other trans people working in the PrEP field in Tennessee and across the country who are all trying to improve PrEP access for all of us. If you have a good experience accessing PrEP as a trans person, please spread the word amongst your friends. And if you have a negative experience, especially related to being trans, please reach out and let our task force know so we can strategize about how to improve things for all of us. You can find us online at www.hivtn.net/TTF. I think when talking about PrEP, it's also worth letting people know what it's like living with HIV these days. Sometimes people are afraid to get HIV tested at all because they're so afraid of the idea of getting HIV. But HIV has changed since the 1980s. So before I go on to talk more about how PrEP could benefit someone, I wanted to make sure everyone knows about HIV treatment. People are often really afraid of getting HIV because they think that they couldn't afford HIV treatment. We have all known people who have needed to raise money from friends and strangers for medical treatment of all sorts of crowdfunding websites like GoFundMe, especially people who've had to raise money like that from transition related surgeries. So it's no surprise that the people worry that they couldn't afford HIV treatment. Please know that HIV treatment is accessible throughout the United States, regardless of someone's income, insurance status, or citizenship status. Even though other types of medical care can be hard to access sometimes, there are programs set up to ensure people can get HIV care even if they're unemployed or uninsured. Most people pay nothing at all for their HIV care. The HIV treatment we now have works so well that it can help someone living with HIV have the same lifespan as an HIV negative person. People living with HIV can have long, fulfilling lives just like HIV negative people. People also worry about getting HIV because they think they could never have intimate, anxiety free sex with someone ever again, and that they'd be permanently pose a risk to their sexual partner's health. But here's something very few people know. Even though it's the best news we've had in the HIV world in decades and totally changes the lives of people living with HIV and their partners, if someone takes effective HIV treatment as prescribed, then their viral load will be suppressed to an undetectable level. If their viral load is undetectable, they cannot transmit HIV through sex. We use the slogan, "U equals you," which stands for undetectable equals untransmittable, to help make sure everyone knows this updated information about how HIV transmission works. Again, a person living with HIV on effective treatment cannot pass HIV on through sex. Now I want to discuss how PrEP can improve someone's life. Aside from keeping someone HIV negative, there are three main areas of life PrEP can improve that I want to focus on today. HIV anxiety, sexual pleasure, control over your own sexual health are the three topics we're going to cover. HIV anxiety. A lot of people have been terrorized by the HIV epidemic, especially many trans communities. We have been taught to associate sex with risk, danger, and disease. That's made even worse by homophobia, transphobia, sexism, racism, and other varieties of prejudice. Sex for pleasure and sex outside of marriage or committed relationships is still very stigmatized. Many people feel a lot of shame surrounding their sexual desires and experiences. Sexual violence and domestic violence are also widespread issues, especially against transgender people. PrEP isn't a cure for homophobia, transphobia, sexism, racism, or rape culture. However, PrEP can significantly relieve anxiety about getting HIV through sex and having to experience the sort of stigma and sexual discrimination that people living with HIV experience. Many people spend a lot of time before, during, and after sex worrying about HIV. They might interview possible partners before sex to try to find out how risky they are in terms of HIV, which can be an uncomfortable process for everyone involved. They may fear getting HIV tests or avoid HIV testing at all because the whole subject is terrifying for them. Even for people who've always used condoms perfectly every time they've had sex, they may experience a significant amount of anxiety worrying a condom may break or worrying a partner may secretively take off a condom during sex. People in a relationship with a commitment to only have sex with each other and be monogamous who don't use condoms in the relationship, they may worry about HIV being a potential consequence if their partner has sex with someone else, without their knowledge, that is. When using PrEP pill daily, someone can have almost complete confidence that they will stay HIV negative in a way that's simply not possible by using condoms or by only having sex in a monogamous relationship with people you think are HIV negative. Many people who use PrEP describe that it's allowed them to have sex without fear of HIV for the first time in their lives. PrEP can also help someone experience more pleasure in their sex life, which is really valuable and important, not just a side benefit. Sexual health is about more than just avoiding diseases, it's about getting to experience pleasure. That's the best part of it. Because PrEP can relieve HIV anxiety, it can allow people to actually enjoy sex to a degree they weren't able to before. Because they're not so overwhelmed by worry and or shame related to HIV risk, many people hadn't even noticed before starting PrEP how much fear of HIV was preventing them from being able to fully enjoy their sexual experience and relationships. Additionally, with PrEP, staying HIV negative doesn't have to require you to restrict anything about how you express yourself sexually or who you connect with sexually. Until PrEP, all the other ways someone had to stay HIV negative required them to avoid certain partners or skin to skin contact in certain types of sex. PrEP enables free sexual expression without the restrictions imposed by HIV risk. For example, because of fear of HIV, some people may be afraid to have anal sex specifically or any type of receptive sex, have sex with people they don't know well, have sex with more than one person during the same time in their lives, have sex without condoms, or have sex with people living with HIV. Avoiding these sorts of things when you otherwise want to engage in them solely to avoid acquiring HIV means missing out on sexual experiences that may hold a lot of meaning and fulfillment for you. PrEP can give someone the confidence to pursue those sorts of sex they truly want to have without being held back by the threat of HIV. PrEP can keep someone HIV negative no matter how they have sex or whom they have sex with. Many people struggle to use condoms. For some people, condoms reduce sexual pleasure in various ways. In order to prevent HIV, condoms must be used during a sexual encounter, which can interrupt sex. Using condoms during sex also requires thinking about HIV during sex, which can remind someone of risk and disease during what we want to be an intimate, enjoyable experience. Condoms also alter the way sex physically feels. However, none of that is an issue with PrEP. PrEP doesn't in any way alter the way a sexual encounter goes or the way sex feels. Someone can take a pill every night before going to sleep rather than think about HIV while having sex. There are various things that can interfere with trans people's ability to enjoy sex that have nothing to do with HIV, like dysphoria about our bodies, concern about how our partners may perceive our gender, and concern about potentially experiencing transphobic violence from intimate partners. We deserve to have the sex lives we truly want to have, and we deserve sexual pleasure. PrEP can be part of that by eliminating HIV worry from our sex lives. Finally, PrEP allows an HIV negative person to have control over their own sexual health, regardless of what their partner does. Without PrEP, people have needed to depend on the person they're having sex with to help them stay HIV negative. For example, by wearing a condom properly or by being monogamous and not having sex outside of their relationship. By using PrEP, someone doesn't have to depend on their sexual partner's willingness to wear a condom while having sex with them to stay HIV negative, or their willingness to be monogamous. That can be especially important for us as trans people because we may deal with sexual partners pressuring us more often than cisgender people experience. Even if someone's partner coerces them or pressures them, PrEP can still protect them from HIV. PrEP doesn't require any negotiation or communication with the sexual partner. Someone can take PrEP without their sexual partner or partners even knowing they're taking it. No other HIV prevention method gives someone that type of freedom and privacy. I want us to finish this virtual session with a couple of stories from trans Tennesseans about their experiences using PrEP. This first one comes from a gay trans man. PrEP has allowed me to have the sex life I've always wanted to have. I started PrEP before I was sexually active in ways that could transmit HIV. I knew that I wanted to have certain types of experiences as I got further along in transition, and I knew PrEP could help me do that safely. Ever since I started PrEP, I've never once worried about getting HIV, not even when I got a call from the public health department telling me a recent sexual partner of mine had just been diagnosed with HIV. It was life changing for me to learn that PrEP does an even better job of stopping HIV transmission than condoms does. I think I'd be very nervous relying on condoms to protect me from HIV, especially with strangers from Grindr. Since I'm the receptive partner, I have less control over whether a condom is used than my partner does. PrEP has given me confidence when having casual sex. I love that my protection from HIV doesn't depend on what anyone else does at all, and that it doesn't even depend on what I do while I'm actually having sex with someone. It just depends on whether I take my PrEP pill every day or not. I used to think it would be really difficult for me to ever be in a long term relationship with someone living with HIV because I thought we could never have sex without condoms, without some level of HIV transmission risk, no matter how committed our relationship was. PrEP and U equals U changed that for me. Now I don't need to care about someone else's HIV status at all because by taking PrEP properly, I'm taking responsibility for my own sexual health. And so, in conclusion, I would love to share a personal testimony about my experience with PrEP. So, for me, I've always been very conservative and laid back when it came to sexual experiences, and I thought that was just who I am as a person. Being able to be a PrEP navigator for a outreach organization, having access to PrEP and watching people actually take PrEP and seeing what it did for them inspired me to also want to be on PrEP. And when I was able to access it, I had the time for myself to do it. And I started to take it. I realized that I was a lot more free in the sexual department than I thought I was, which is a good thing, I think. I don't think your sexual experience should determine your work or who you are as a person. There's so many other things that can do that. I think that we put too much focus on things that don't have anything to do with what really matters, how we treat each other. And PrEP allowed me to move past those fears to focus on how I treated myself in an area that I wanted to treat myself a little bit more freely in. So that's my personal testimony and want to thank you for being a part of this presentation and listening to all of the stories in mine. And that's it for today. We're planning more short videos on trans health topics. So if you have any ideas, go to this website and let us know what you'd like to see next. Thanks for listening.